The nation's hospitals making emergency demands. Some doctors and nurses running low on protective gear, many reusing their masks. Some hospitals reporting a 50% surge in coronavirus patients. Here's ABC's Adrian Banker.
Tonight, a massive rush to get tested suddenly cut short. Hundreds of people arriving before 4:30 this morning, waiting in a mile-long line at New Jersey's biggest drive-through testing site. But just 30 minutes after opening, they hit capacity, and police had to turn people away. Medical professionals now advise that only those with severe cases seek medical help. Inside hospitals tonight, there's growing concern.
It's a scary time to be a doctor in America, and especially in New York.
Dr. Cornelia Griggs, a mother of two, is a pediatric surgeon who works with coronavirus patients at Columbia University Medical Center. She says she's worried the hospital could run out of masks, eye protection, and gloves. Her message on Twitter, "Don't make us orphan our two toddlers."
It's forced me to feel like I have to live apart from my children in order to protect them, and that breaks my heart.
Internal memos written by Columbia University's chief surgeon, Dr. Craig Smith, say that his hospitals have seen a 50% increase in coronavirus patients, burning through 40,000 masks every day, adding that officials predict the number of cases might not even peak for another 32 days. Two New York area medical professionals we spoke to tonight are worried about what lies ahead.
We're filling up our ICUs. We have several floors now that are devoted only to COVID positive patients.
There's a misconception out there that this is a disease that only affects the elderly and only affects people who have significant medical problems. And that's not what we're seeing in the hospitals around New York. We're seeing younger people.
Many doctors tell ABC News over the past few weeks they're being forced to reuse masks and protective gear. But even with the stories of nationwide shortages of N95 masks and other gear, Mount Sinai Hospital in New York City says it has sufficient supplies and is prepared for things to get worse.
On the whole, I would say I'm feeling inspired just being able to watch the stuff that my colleagues are doing. It's absolutely incredible. I think what people have done over the last month.
Tonight, researchers at Columbia University estimate the number of undetected cases is 11 times higher than what's officially been reported and predict that 650,000 people could be infected over the next 2 months, even if the transmission rate is cut in half. Attorney Manny Alejandro tried to get tested at this urgent care center in Brooklyn, instead finding this sign posted that said no more COVID-19 tests. 49-year-old Dr. Jean-Luc Neptune tested positive for COVID-19 6 days ago, cautioning that this disease be taken seriously.
Joint pain, myalgias, muscle pain, have had that as well. I literally had a fever for 10 days, some days more than 101, which is very uncomfortable.
Detailing those symptoms, we could hear the cough right there. Adrian Banker joins us. And Adrian, we just learned that FEMA will be setting up new medical stations in the 3 states that have the most coronavirus cases right now.
Yes, that's right, Tom. The president making a major announcement. He says that FEMA will set up those makeshift hospitals in California, New York, and Washington state, providing thousands of new hospital beds. Tom.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.